It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. Happy Wednesday, and thank you for joining us for another new episode of Morton in the Morning. I'm your host, Julie, and we are broadcasting here from Morton Hospital in Taunton, and we're excited to be joining you with another new show for the new year. If you missed last week's show, we spoke with our entire quality team here at the hospital about some of the quality and safety initiatives that we have going on, as well as some recent accolades and awards that the hospital has received. And the big one that we talked about was the grade A that we received from the Leapfrog Group's hospital safety grade for the fall 2020 update. So we received an A and are among about a third of hospitals across the nation to receive an A safety score. So we are so proud of that achievement, and we want to again congratulate our entire staff. That award is a testament to the safe patient care that they provide here at Morton Hospital every day. If you're interested in hearing that show, it's not too late because we actually share a link, an online link to listen to our show on our Facebook page every week. So if you visit our Facebook page, if you either search Facebook for Morton Hospital or go to facebook.com/Morton Hospital MA, you will see our page and you'll be able to listen to last week's show as well as all of the shows that we have posted a link to listen to online. So today we're excited to be bringing you another new show, but before we get started, just want to share the information about how you can contact us here at our show. So we've set up a special email address for you to reach out to us if you have any feedback, if you have any questions, or if you have any ideas for shows, anything you'd like to hear us talk about in the future. You can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org, and we would love to hear from you. You can send us an email at any time. For today's show, given it's the new year, we thought it would be a great idea to talk about primary care and the importance of having a primary care provider, and maybe hear some tips about some healthy lifestyles suggestions for the new year. Okay, so for today's show, we are happy to be interviewing one of our primary care providers, Dr. Nawar Najjar, and we are actually interviewing him over the phone. He's over in his new office at SMG Primary Care at Paramount in Rainham. So, Dr. Najjar, thank you so much for joining us today.
Oh, thank you, Julie, for having me.
Okay, great. So, you're in the brand new office. How is it going over there?
It's great, actually. We moved here in October, and so far it's been 3.5 months, and I think we're excited, and our patients are excited about the new location. I think things are going well.
Great. It's definitely a beautiful suite over there, that's for sure. So for those who may not know you, let's have you start by talking a bit about yourself and your background.
Okay, so I graduated from medical school in 1999. Then I did my training in internal medicine in Chicago, and I finished training, and I moved to Boston area, and I worked in Morton Hospital. So I finished my training in 2006, and I worked in Morton Hospital as a hospitalist from 2006 until 2013. Then I started primary care from 2013 until now.
Okay. And you had practiced some time over in Middleborough. That's where you moved from recently, correct?
Correct. So I worked actually from 2013 until 2020 in Middleborough, and then I just moved here to Rainham in October 2020.
Okay, so tell us about, because you are now practicing with some providers that you weren't originally practicing with, though you were all, I'm sure, very good colleagues. So tell us about who else practices with you in the new office.
So in the office in Paramount in Rainham, we have 4 providers: Dr. Volney, Dr. Raquel Volney, and Dr. Ron Volney, and Dr. Brett Stecker.
Oh, that's great. So can you tell us about, what offices they moved from and, what sort of prompted the decision for you all to come together in a brand new practice?
Yes, so Dr. Volney's both were practicing in Middleborough, in the same building actually where I was practicing, and they moved here with me to Rainham. Obviously, the new office here is bigger and more modern, and the office is newer, so I think it served our patient better. So that was the main purpose of the move, which still wanted to be close to our office in Middleborough. So for our patient in Middleborough and Lakeville and even in Plymouth area, they will not have a big burden to commute to Rainham. Dr. Stecker was practicing actually in Rainham, and then he moved to Taunton for some time of I think around 9 months, and then he moved back here to Rainham. So that's how we are relocated, 4 of us in this office.
Okay, excellent. And I think, we haven't had a large primary care office in Rainham for some time, so it's definitely a great benefit to, like you said, close to the patients in Middleborough, but also a great benefit for the patients in Rainham who might need a new primary care provider close by.
Definitely. We are very excited about being in this community, and we're already seeing a new patient coming to the practice that they live in Rainham, and they do express that it's a good thing for them to have a large practice available here for them in Rainham that serve the same community that belongs to Morton Hospital.
That's great. Well, I'm glad it's going well. And, because we are still in the midst of the COVID-19 pandemic, talk about the options for patient visits. Are you seeing patients primarily in person, or are you continuing to offer telehealth visits at your office?
So we are actually doing both. We are doing the telehealth, and we are seeing patients in the office as well. So for people who can make it to the office, we do have very strong screening process to make sure that the patients that come here to the office are very safe by not getting exposed, by screening everyone who comes here in case they have any symptoms that's concerning, even that sometimes the patient may not recall to report it, but we do have a screening process to everybody who comes here. Mm-hmm. And our staff also are very good at making sure that all the precautions in place, from social distancing in the waiting room to the process with the check-in and check-out. For people who obviously have any symptoms, we do telehealth appointment with them because we want them to be quarantined at home until we make sure that they get the appropriate testing to see if it was COVID or not. So for these people, we do telehealth. Mm-hmm. Also, the telehealth is an option for people who still do not want to leave their house, or for people now that, as the telehealth is an option for people that physically cannot do it because other obstacles.
Okay, great. Well, I do want to hear a little bit more from you about your thoughts on telehealth and if it has been beneficial for you and your patients. I also have several other questions for you, so we have a lot more with Dr. Najjar, but we do have to take our first break of today's show. Again, today we're interviewing Dr. Najjar, who just recently, in the past few months, moved over to the SMG Primary Care at Paramount office on Paramount Drive in Rainham. He relocated there from his former Middleborough office, and he practices there now with Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ron Volney. So we look forward to speaking more with Dr. Stecker about his office and their areas of expertise following this short commercial break. So please stay with us.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's episode of Morton in the Morning. Thank you so much for joining us today. We are today interviewing Dr. Najjar, who is one of our primary care / internal medicine specialists. We are interviewing him from over the phone. He's actually in his brand new office over at SMG Primary Care at Paramount on Paramount Drive in Rainham, where he recently relocated to from his former Middleborough practice. And we've been talking to Dr. Najjar a bit about the safety protocols that they have currently in place at their office, given we are in the midst of the COVID pandemic. And we started to talk a bit about the options for patient visits. We spoke about the option of in-person visits as well as the option of telehealth visits. And I know that I've spoken to some other providers here about, their thoughts about telehealth, and it was all very positive, actually. So what's your experience been like with telehealth, and do you still feel it's a very, it's an efficient and appropriate means of, seeing patients?
I think definitely it is very helpful. Now, there is nothing that will replace seeing the patient in person and examine the patient in person. However, a lot of time people were missing appointment because of schedule that couldn't work or they cannot make it. So telehealth is a useful tool to kind of bridge you with your provider to address the problem until you're able to see them again. It will never replace the classic interview between patient and doctor, but it is helpful when you cannot see the patient in person, and definitely it's very helpful now in keeping our patient safe and our staff safe. If a patient has symptoms that need to be addressed that could be suspicious of COVID-19, rather than bring them here to the office and expose other patients to the risk. So definitely it's serving for this purpose very well.
Absolutely. And like you said, it's also a great option for people who may have barriers, like, a busy schedule, or someone who may have transportation issues. So it's definitely a good option, and I'm sure it will be around for quite some time, even after the pandemic is over.
Yes, we hope so.
Okay, so let's dive into talking about you and your areas of expertise. So what particular areas of internal medicine do you have a special interest in?
So basically, as a primary care, we address quite a wide range of disease, including the very common diseases that we see every day a lot of patients that have it, diabetes, high blood pressure. Definitely, we are very focused as primary care about preventive care to make sure that screening for cancer, helping people quitting smoking, helping preventive measure to make sure that we have people as healthy as possible in the community. So I would say preventive care and also like diabetes and high blood pressure. These are the main focus of what I practice every day.
Okay. And we have quite a large network of specialists actually affiliated with Morton and within our network of providers. So as a primary care provider, you're sort of like the gateway, that you're the first person that people see. But then if they have another issue that would be best treated by a specialist, can you talk about some of these specialists that you collaborate with most often in caring for your patients?
Sure. So, as you said, there are a great network of providers in the area that we refer to, from gastroenterology service to pulmonary service to great orthopedic department with new few doctors that they joined recently that we're very excited to have. That we serve pretty much every specialty in medicine that our patients need around here. So less and less, and I would say not common at all, that our patients need to travel far to get any kind of service to a tertiary care center, which we do have affiliation with in St. Elizabeth, that we do refer a lot to there when we need to. But I think our patient in the community can get most of their care they need around here in convenience and not far from home at all.
Absolutely. And certainly over the past couple of years, that's been a goal for our hospital, and we've been successful in growing our specialist network, specifically, whether it's surgical specialists or psychiatry specialists. We just welcomed a brand new psychiatry specialist and many other specialties. So, like I said, we do have a large network, and it's convenient for patients to have access to that care nearby. So now that we're in the new year, many people, maybe they've already made their New Year's resolutions, maybe they're working on them, but a lot of the times those New Year's resolutions have to do with better health. So in general, can you offer some best tips for maintaining optimal health and wellness?
Sure. So as you said, it's a new year and everybody is looking to be healthier and feel better. I usually tell my patient that, resolutions start by changing our behavior, but results take a while to show. Mm-hmm. So don't get discouraged by not seeing very quick results. You just have to be patient about it. And usually when I talk about my patient about, like, let's say they were going to work on their blood pressure or they want to work on their weight loss. So we set reasonable expectation to make sure that you don't get discouraged by looking in 2-3 weeks from where you are and you say, well, it didn't work, so probably I shouldn't do it. So don't give up quickly because results take some time to show. So set for yourself small goals that you can achieve rather than having large goals that you want to get to in very short term. That sometimes it's difficult. And always work with your doctor about what you want to do and see what's their input, see what they can offer to help you to achieve these goals.
Okay, and I think that's a very important point. You mentioned working with your doctor. Hopefully most people have a primary care provider. Some people may not, but why is it so important that everyone have an established primary care provider?
It is definitely helpful because, for two reasons. the most important thing is that you want to make sure that you get the appropriate preventive care. By what we mean by preventive care is make sure that you get the testing and the evaluations that you need when you do not have any illnesses, because that can help a lot of time pick up things that are in a stage before they give any symptoms, which makes it much easier to tackle with less adverse effect and from treatment or anything. So a lot of people, they say, well, I feel fine, but that's the whole goal of preventive medicine, that you do some testing and some screening according to guidelines that they've been put in place based on so many years of medical studies and medical care, that you get the care when you're feeling fine. That's the whole point of preventive medicine. The other reason that why you should have a primary care, because in case you have an issue, sometimes to establish primary care, new primary care, it could be sometimes taking 1 month, 2 months for a new patient appointment sometimes, when if you have established primary care, you can always call and have the problem addressed much faster. So this is the other reason that also I encourage people always to have established care with the primary care, to be always able to reach out and get evaluated in a timely manner.
Okay. And so let's talk about, often people might only visit their primary care provider just for that annual wellness visit. So what are your suggestions? What are some of the questions or topics that should be discussed during that visit?
So basically in the annual wellness visit, we bring up the preventive care, which is testing and evaluation based on your obviously sex and age. For example, people who are the age of 50, they need to have colon cancer. For women at certain ages, start to have a mammogram to evaluate any early or detect any early breast cancer. So these are the things that we address, make sure that the patient get them on time. Also, we go over the family history, because there's a lot of disease that they have familial in predisposure. So we make sure that we address all these issues. We talk about their lifestyle habit, about diet, about exercising, about how we can improve their lifestyle, and obviously we talk about anything that they want to bring up to discussion.
Okay. All right, great. And, just in general, how would you describe your care philosophy?
So basically, my philosophy is patient-central care. So we always put the patient up front is the priority, and there is all the tools and the guidelines that we have. However, it's always my attention is to make sure that I serve the patient himself or herself to what they want and how they want to be served.
Wonderful. So I appreciate all that you've shared with us today and all the great tips that you provided, and definitely gave a great overview of why it's important to have a primary care provider. Is there anything else that you'd like the community to know about yourself or what your practice has to offer?
Well, thank you very much for your time and for this interview. I would like to just emphasize what you mentioned, that everybody should have a primary care, and we are very excited about our presence here in Rainham community, and we are looking forward to serve more and more people. So I think we have a good chance to do it, and we're very happy about our presence here
Great.
in the new office.
All right. Well, Dr. Najjar, I want to thank you so much. We're, like I said, very happy to have you in the Rainham community, and we've also been happy to have you as part of our Morton family for so long. Thank you very much for your time, and at the end of this segment today, I'll definitely share the phone number about how where people can contact you if they have questions or if they want to book an appointment with you or a member of your team. Thank you so much for your time, Dr. Najjar.
Thank you.
Okay, so some great information from Dr. Najjar, especially emphasizing the need for or the importance of having a primary care provider that you can visit on an annual basis or whenever you have something that needs to be looked into. So if you are in need of a primary care provider, I will give the office information for Dr. Najjar's office along with the Drs. Volney and Dr. Stecker. Their phone number at SMG Primary Care at Paramount is 508-738-6740. Again, that's 508-738-6740. And they are located right off of Route 444 on Paramount Drive. Thank you again to Dr. Najjar for his time and the great tips that he provided to us. We are halfway through our show, so that means we're going to take our second break of the day. So stay tuned, and we'll be right back after these short messages with a second interview with another one of our primary care providers located right here in Taunton. Stay with us. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to Morton in the Morning. We're so happy that you've joined us today. In the beginning of our show, we interviewed Dr. Nawar Najjar, who practices at SMG Primary Care at Paramount. And we wanted to focus our show today all about primary care. So for the second half of today's show, we are happy to be interviewing another one of our primary care providers, Dr. Tatiana Thom, who also has a subspecialty in nephrology. And Dr. Thom is practicing at our SMG Taunton Medical Office right on Court Street, which is very conveniently located. So Dr. Thom, thank you so much for being here with us today.
Thank you for having me.
And we're also interviewing Dr. Thom over the phone. And why don't we start by having you tell us a bit about yourself and about your background?
I'm Brazilian, and I moved to the United States in 2005. I did medical school in Brazil, and then here in the United States I did residency in internal medicine, general medicine, right? And then I worked in the hospital for 1 year when I decided to go for nephrology and hypertension specialization. And then after that, I worked in nephrology for a few years and decided to go back and do internal medicine and nephrology. A little bit more about me. I decided to go for medical school when I watched my father working as a pharmacist. And in Brazil, he used to work also in the counter, talking to patients. So patients would come and talk to him, and a lot of times ask for advice. And working in the summer with him, you know, when I had finished high school, when I was going for pre-med. Or actually, I was not doing exactly pre-med, but, you know, going to the area of biological sciences, I watched him with the patients and giving advice, and a lot of people would come back and say, oh, my goodness, this is like the best advice I've ever gotten, and I'm so much better, and I've seen so many doctors before. And then they would send their neighbors, their family, and I thought that was so amazing, so exciting. And I thought, well, I want to be a doctor, the kind that, listen to the patients and, take a holistic approach, which is, an approach that you advise on different areas of their life, not just like a medication pusher. And I thought that was so exciting, and that's how I decided to be a doctor, inspired on my father's working as, a counter pharmacist in Brazil.
Oh, that's wonderful. That's a great story, and we're certainly very happy that you decided to become a doctor and also to join our team here. And you actually practice with quite a large team over at Taunton Medical. Can you talk about the team and who the providers are?
Yeah, I'm very, very fortunate to be part of this amazing team. So we have several providers here, and I'm very lucky to call them friends. They're amazing people. So one of the doctors here, Dr. Corte, we actually went to internal medicine residency together back in University of Connecticut.
Oh, wow.
In Connecticut, yeah, that was in 2009. So we are friends for 10 years, and we continued friends for all this time, and we really enjoy working together, and we definitely have a great collaboration. Also, another Brazilian, Dr. Ricardo Ribeiro, who became a dear friend of mine, too. We definitely collaborate together quite a bit here. We also have Paula Teixeira, who is an amazing PA, very lovely person. She has been here since the beginning of Taunton Medical, almost 20 years ago, and she's loved by her patients. She's very experienced. We also have Nicole Najjar, nurse practitioner, who is a lovely person, very well loved by her patients as well. And it's a great team. We're going to be, Dr. Rasmussen from Mill River will be joining us, and we're very happy to have her soon. And we have the support of this amazing team, who most of them speak Portuguese, which is really a great thing to serve well our Portuguese and Brazilian population here.
Yeah, that's amazing. I was gonna talk about the convenience of it being located on Court Street, but that another great thing is that the staff speak Portuguese as well. So, in your opinion, why is that important for our community?
I think it's a key. It's one of the greatest things of our office. 4 of the 5 providers speak Portuguese fluently, which is a great convenience for our patients. A lot of the Brazilian patients are actually new and don't speak English very well, and a lot of our older Portuguese patients do not speak English very well either. So it's so good to have a provider that really understands the intricacies of our language and also the culture. I think that's really a key thing. I think it's much easier to understand each other, to be able to help each other. Also, a lot of our secretaries and MAs speak Portuguese, which comes very handy to understand what's going on.
Absolutely. That's wonderful. And we do have a high Portuguese population in our community. And outside of English, Portuguese is the next highest language of, language spoken by patients that we see here at the hospital too. So that's absolutely wonderful that the office does speak that language for your patients. So your primary specialty is internal medicine. So can you talk about some of the areas of special interest within internal medicine that you have and what types of conditions you enjoy helping your patients with?
Yeah. I would say that the areas that are my special interest are high blood pressure, which the medical term is hypertension, or the Portuguese from Portugal and the islands called tension. That is definitely a special interest area of mine because it is very common, and unfortunately, people can go decades of high blood pressure with no symptoms at all. I think a lot of people have this myth of, if I have high blood pressure, I'll have a headache, or I will have chest tightness, or I'll feel lightheaded, or I'll have, shortness of breath, which is not true. most of people, 90% of people, can have a blood pressure as high as 200 over 150 with no symptoms. And that will damage your vessels, increase your chances of having kidney failure, heart attacks, strokes, with absolutely no symptoms at all. And that will really damage your life, your health, right, your body. And I really like educating my patients on how to prevent high blood pressure when we see a borderline one already, and also treat, the importance of treatment, because that can really destroy your body in a very silent manner.
Absolutely, yeah. It seems like sometimes those silent conditions can sometimes be the most severe and cause the most damage because you don't necessarily know about them.
Yeah, and diabetes is another one. So diabetes is another very silent disease. You can have blood sugar in the 300s, 400s for years and years without really having symptoms. You just start having symptoms when your body really burned out and it already damaged several of your organs. So as also a nephrologist, I really care about treating the diabetes and high blood pressure most of all because they're silent, and they are the biggest reasons why people lose their kidney function.
Okay. So let's talk about your specialty in nephrology. For both myself and our listeners, can you explain what nephrology is and what types of conditions you treat?
Yeah, so nephrology is the specialty that takes care of the kidneys and also the electrolytes, the salts in your body, because that's what the kidneys take, administer, or let me use a better word. Let's say the kidneys are the ones that are the gateway for losing or conserving some minerals in your body, and that is so important for how your body controls blood pressure. The kidneys actually are the main controller of the blood pressure, even though people think it's the heart, right? But the main reason the main condition actually that we treat with the kidneys are actually when the kidneys, what we call chronic kidney disease, when the kidneys are really not being able to filter and get rid of the toxins as well as it should. And the main reasons why people get kidney disease is actually uncontrolled blood pressure and uncontrolled diabetes. Those two are responsible for 90% of the cases of loss of kidney function and need for dialysis.
Wow.
So that's one of the, and those are the most common diseases that people have.
Absolutely. So, very important work. Obviously, it's incredible that you have that subspecialty, because then you can focus on, like you said, all the most common conditions associated with primary care, but then with the nephrology angle, all of the various kidney diseases that are very common as well. So, Dr. Thom, I do have more questions for you, but we are at the point where we have to take another short commercial break. So if you'd be so kind as to stick around, we will be right back after these short messages with Dr. Tatiana Thom of our SMG Taunton Medical Office. Stay tuned. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to the final segment of today's Morton in the Morning show. Thank you so much for listening. We hope you've been enjoying the show thus far. Today our show is about primary care, and we spoke earlier in the show with Dr. Nawar Najjar, and now we're speaking with Dr. Tatiana Thom, who practices with a whole team of providers at SMG Taunton Medical, which is located right on Court Street in Taunton. Very convenient, right close by to downtown and right down the street from Morton Hospital. So we are talking to Dr. Thom about her areas of expertise. She is a primary care provider, but also has a subspecialty in nephrology. So earlier in the show, I spoke with Dr. Najjar, and he spoke a bit about the importance of having a primary care provider. So I wanted to hear from you, what approach do you take in developing a good relationship with your patients? What's your philosophy?
Well, my philosophy is that you need to be present. You need to be there, conscious, and listen to the patient. So my approach is listening and taking their complaints serious. So the patient knows that I'm there, I'm hearing, and I care. Mm-hmm. I think that's one of the things that I never have to explicitly say, but the patients know that I care because I listen and I will address every single complaint. I might not respond how some people would expect, because of course I have to respect, science. I have to respect all the knowledge and the experience I got over the last 15 years, right, that I've been practicing. And but I think the most important thing is that you really care. You want to make that person's life better one way or another. And that's the reason that I focus so much on prevention. I think the best medicine is preventing problems.
Mm-hmm. Absolutely. And there's definitely a shift toward that versus just treating conditions. Prevention is certainly huge, and it's been that shift toward prevention over the past few years in medicine, I think. Mm-hmm. So, we're in the midst of the COVID-19 pandemic, and a lot of people might be struggling with, issues from a mental health standpoint. And I know you talk about, listening to your patients, but can you talk a bit more about the importance for screening for mental health issues when patients come in for their annual wellness visits?
Oh, yeah, I think you raised like a really key subject, especially at this point. Mm-hmm. Mental health is extremely important. I would say more even important than physical health, because without your mental health, it's very difficult to have even physical health, right? And vice versa, I would say. But definitely the social isolation and the fear has taken a toll on most people, even the healthiest of ones. Mm-hmm. And we definitely screen for mental health. We talk about how life has changed for each person during the pandemic. It's actually the first thing I ask people when they come, and knowing how people are coping, and actually definitely helping people to cope in a different manner. I always suggest different approaches on coping with the social isolation, and we can offer so many resources, especially the ones preventing deterioration, but we also can offer medications and referrals when needed.
Absolutely. And I would imagine, if one is struggling mentally, that's also going to impact their lifestyle. For example, they may be more sedentary, which in turn could, impact their weight or their diabetes. Is that right? It's sort of like a trickle-down effect.
Absolutely, Julie. You hit it on the nail. When people are, more sedentary, more anxious, their hormone levels totally change, and also their, dietary habits have been changing too. And people are eating their feelings and their anxiety more often. So that's something that we talking about changing a little bit of the habits, what to eat, how to exercise, how to communicate their feelings, and that's something I would definitely talk very openly with my patients and give different tips about, and we talk, right? It's a communication two ways, right? It's not just like do this, do that, do that. We try to learn what will fit on their lives with whatever budget they have and whatever resources, because not everybody has a lot of family around and children around to help them, and not everybody has access to online shopping. So we have been researching ways to help a little bit and alleviate the stress on everybody.
That's amazing. It sounds so important that you're focusing so much on the mental wellness versus just the physical wellness. So this has been great so far, but I do want to end with an important question, and maybe you could just give your general advice to our community. What do you recommend when it comes to just living a healthy lifestyle in 2021? Some general advice.
Oh, that's great, Julie. I love that you asked that. And I would definitely say that I would start with changing the expectations for 2021 to giving appreciation on being grateful for, waking up alive, from our family that is healthy. Instead of looking at the negatives that happen, everybody has a bad story to tell. But I think we really have to focus on the positivity of it. I'm sure everybody can dig something positive. Sometimes it's a better relationship that we got with our family because now they're more present and helping, even though not physically, but you open some channels of communication. If it's not that, maybe it's just the fact that you're alive, or maybe the fact that you learn new things, new tricks on how to survive in a social isolation. So I would say changing expectation to appreciation would be a big one, especially in the mental lifestyle area. But another one would say exercise. You might be, but Dr. Thom, the gyms are closed. Yeah, for most people, you can find music somewhere, right, in your house, one way or another.
Absolutely.
Or even if you know how to navigate the internet, you could go to YouTube and put Zumba class or dance class or beginner Zumba 15 minutes. And you know what? Dance a little bit. It's an amazing exercise for your mind, for your body, for your heart, for your legs, for everywhere. So I would definitely say a healthy lifestyle that will change all over your life would be a little music with a little dancing. Research shows it's the best exercise ever. So even if you just do a little dance party, you and your cat, you and your dog, you and your daughter, your husband. So dance party, that's the word, I would say.
And at least with the cat and the dog, they won't be so critical of the dance moves.
I bet they're going to love it. I bet they're going to ask for more. So let it loose. Be a little goofy. Be a little fun. Be a little sexy. Why not, right? That's going to be great.
Yeah.
So I would say a little dance party will really heal a whole lot inside your heart, your mind, and your body. Today, tomorrow, and every day.
Okay.
And I would say definitely incorporate more vegetable portions in your life and a whole lot less sugar.
Well, that is amazing advice. Thank you so much. I feel like I've learned so much from you just in this short time. And it's been wonderful to hear about your philosophy toward caring for your patients. So we so appreciate having you and for your time today. And thank you to you and your team over at Taunton Medical for all you're doing. And hopefully we will be able to talk to you again soon. Thank you so much, Dr. Thom. We very much appreciate it.
Thank you, Julie.
Okay,
Thank you for
take
everything.
care.
Have a wonderful day and a Happy New Year.
Same to you. So, wow, that was a great show. I learned a lot, and I hope all of you did as well. We have some incredible providers here, as you could hear and tell from them speaking about their care philosophy. Earlier, I did provide Dr. Najjar's office phone number, so I will do the same for Dr. Thom and the SMG Taunton Medical team. If you need an appointment with that group, you can call 508-821-2500. That's 508-821-2500. Before we end our show today, I do just want to give a quick reminder about contacting us here at our show. We've set up a special email address, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And you can send us an email at any time if you have any questions or if you have ideas for upcoming shows, anything you'd like to hear about. Or if you just want to give us some feedback about how you've been enjoying listening to our show, we would love to hear from you. So email us anytime, mortoninthemorning@steward.org. So that wraps up our show for today. We hope you will continue to join us every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. If you've missed any of our past shows, we do share the link on our Facebook page. So it's facebook.com/Morton Hospital MA, as in Massachusetts. That's facebook.com/MA. So you can find the links to our previous shows there, but also stay up to date on everything that's happening here at Morton Hospital. So thank you so much for joining us today. We wish you a very happy and healthy week from all of us at Morton Hospital, and we look forward to joining you again next week. If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.